That thing they clamp and cut with the scissors when a baby is born. Did you know that before birth, it was basically your baby's support system? Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. So today, let's talk about the umbilical cord, what it is, what it does, and what we look out for when we see it on an ultrasound. The umbilical cord is the structure that connects the baby to the placenta. The placenta is where the exchange of oxygen, nutrients, and waste products between the mother and the baby takes place. The cord then serves as the baby's transport route between the baby and the placenta. A normal umbilical cord usually contains 3 blood vessels, 1 umbilical vein and 2 umbilical arteries. The umbilical vein carries oxygenated blood, that is nutrient-rich blood, towards the baby. The 2 umbilical arteries carry blood away from the baby towards the placenta, carrying carbon dioxide and waste products that needs to be exchanged through the placenta. These vessels are surrounded by a jelly-like substance called Wathon's gel. This Wathon's gel helps to protect the blood vessels from being compressed or damaged. So there is actually quite a bit of protection around those vessels. So in simple terms, what does an umbilical cord do? Think of the umbilical cord as a transport system. It helps to deliver oxygen, nutrients, and other substances needed for the baby's growth. And it helps transport waste products away from the baby towards the placenta. So yes, that umbilical cord we are seeing on ultrasound is doing some serious work. And then what does it look like on ultrasound? If we take a cross-sectional view of a normal cord, we expect to see 3 vessels, 1 vein and 2 arteries. The arrangement can sometimes look like 2 small circles and 1 large circle. Now let's talk about one of the things that scares pregnant women the most. They always ask if the cord is around the baby, especially the baby's neck. This is called a Nuchal cord. A Nuchal cord is a common situation in which the umbilical cord is wrapped around the fetus neck, and having a Nuchal cord does not automatically mean that the baby is in danger. We have types of Nuchal cord. We have the single Nuchal cord. In this case, there is just 1 loop of the umbilical cord around the baby's neck. And we have multiple Nuchal cords. In this case, there is more than 1 loop of umbilical cord around the baby's neck. This Nuchal cord happens randomly, but the biggest risk factors include excessive fetal movements, a long umbilical cord over 27 inches long, large amounts of amniotic fluid, that is polyhydramnios, and there is nothing you can do to manage these risk factors from the outside. It is not your fault that your baby has a Nuchal cord in the womb or when they are born. Please note, the cord can be around the baby's neck, sometimes even more than once, without causing a problem. However, during pregnancy and labor, one possible sign of a Nuchal cord is the decrease in fetal heart rate when monitoring it. This means that the fetal heart rate temporarily drops below a healthy rate. But please don't hear cord around the baby's neck and immediately think, my baby is being strangled. That is not how it works. And then, one particular important condition that has to do with the umbilical cord and the placenta is vas previa. This is where the fetal blood vessel runs near or over the internal cervical opening. This is one of the reasons placenta and cord assessment is an important part of pregnancy ultrasound. Now let's come back to the scissors you see during delivery. After the baby is born, the umbilical cord is clamped and cut. The remaining piece attached to the baby's abdomen becomes the umbilical stump. That is where you see the navel. It dries out and eventually falls off, leaving the baby's belly button. So yes, that is that same cord we have been looking at on ultrasound throughout the pregnancy. The umbilical cord is much more than just that thing they cut after delivery. It is the baby's connection to the placenta, and it contains blood vessels responsible for transporting oxygen, nutrients, and waste products between the placenta and the baby. On a normal ultrasound, we expect to see 3 vessels, 2 arteries, and 1 vein. And if an ultrasound report mentions something about the cord, in rare cases, instead of seeing 3 cords, it could be 2, or a Nuchal cord, or abnormal insertion or something else. Don't panic from the name alone. The findings has to be interpreted in the context of the baby's anatomy, growth, blood flow, and the overall pregnancy. And then, I've mentioned the placenta multiple times. If you want to know more about the placenta, check my previous video. So next time you hear about the umbilical cord, you can relate better. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and follow for more simple ultrasound explanation and women's health education. And I'll see you in my next video.